agencies or facilities kind of preyed upon new graduates. And I felt also women, as women physicians, we know that we are classically paid less than our male counterparts. That's just a fact, a statistic. So I knew that I needed to be aggressive from the beginning.
Remember my first 5 years were in academic. So when I became like locums, I was so shy about it.
Yeah.
So I think it's kind of inspiring that you were able to do it from the get go, because I feel like medical training, they kind of beat us down, like you're not supposed to talk about money. So it's really good that you were able to kind of get confident with what you were doing. And I know that came with experience and time. And so that's, I think, a good segue to go into what you're doing with Dr. Jacobs Health. Tell us a little bit about your business.
Yeah, absolutely. And that was something that was kind of striking to me when I first started as well. I found that like agencies or facilities kind of preyed upon new graduates. And I felt also women, as women physicians, we know that we are classically paid less than our male counterparts. That's just a fact, a statistic. So I knew that I needed to be aggressive from the beginning. And the thing that frustrated me when I first started out was that no one was talking about their rates and how much they were getting paid. And as a new grad, I had no idea where, like, what is a crazy range or what's a normal ballpark? Am I getting scammed or ripped off? And like you mentioned, in residency, like in medical school, a lot of times we have a hard time knowing our worth because, you get a beat down. That's just how it is. Um, and coming out into attendingship, I knew that I wanted to have adequate pay, and I knew how hard I worked and that I was a good physician. So I started doing social media and talking about my rates so that other people could have like here's like a baseline where I should be looking. And then you kind of know, okay, if I go above this, that's kind of high for our specialty, or below is a little substandard. And then people really responded to that. So I liked I love helping other physicians, especially female physicians. So I was asking or answering the same question. So I just made a guidebook, and then people wanted to do calls, which I loved. But, I get so involved in talking to people that it was taking up a lot of time. So I started doing a coaching program where I can talk to people one on one and answer their very specific specialty related questions. Um, and then I did a video course. I filmed it over across 5 different countries, actually, to kind of highlight the amount of time freedom that locum tenens work gives me, so that people can see, okay, wow, she's in Italy or Switzerland or Germany filming these modules and talking about the freedom that locum travel medicine brings. And I did that just so people could get more of an in-depth idea of how to get into travel medicine, especially straight out of training, because I just had a million questions when I first started. And as you all know, it's just such a steep learning curve. You learn so much in the first couple assignments that I wanted to try to capture those learnings into a video module and digital downloads and things like that.
How do you personally manage the travel with personal life or relationships, especially as a woman?
It's very challenging. Very challenging. If I can bring my partner with me on assignments, it makes it so much more fun. But there are advantages to doing assignments on your own. Like when I went to Alaska by myself in the winter, I learned a lot about myself. That was very challenging, and I wanted a challenge. I did that intentionally and on purpose. It allows you to, really go outside of your comfort zone, meet other people, experience a city on your own. But it is hard. Thank goodness we have FaceTime, we have the phone, we can text. Like, I'm doing all of those things after hours and catching up with people. I love postcards. I'm a postcard girl, so I'm always getting postcards from wherever I am and sending them to family and friends, so that we can stay connected. But I do a lot of FaceTiming to stay grounded and talk to people that are in my close circle, even if I'm far away from them. But it is really challenging. I don't have children. People do it with kids. I have a lot of friends that do. That adds another layer of complexity to it. But people do it. You have to kind of plan around, of course, schedules and school breaks and things. Do you guys have kids, or do you comes with your kids or bring them along, or how do you all do it?
I have two. I have a 4-year-old and a 6-year-old. I don't travel, but even just having a full-time job, which I did before, it was very challenging to balance between kids and our medical life, right? But it's getting better now that I'm independent and I have more autonomy. I have more flexibility. It's much better.
I don't have kids, but I have a husband. But I do have the freedom to travel. I try not to travel too much just because I
Yeah.
do like being at home, and just being in New York, I haven't had to travel too much
Mhm.
just because there's such a high density of hospitals here, including smaller community centers that need the per diem coverage. So I've been lucky on that end, but I've certainly like gone to more rural places. Like I was at an assignment in Pennsylvania pretty regularly. I mean, I'm not opposed to traveling, but the money I'm getting actually in New York's pretty good, and it's hard to match that in a different state, which is really like strange because you would think if they want you to come to the Midwest or in the middle of nowhere, they'd want to hike that up. But I don't know. Maybe I need to start reaching out to different hospitals on my own too, because I don't know if you've noticed this, but some of the locums agencies, there's a lot of variability in the
Mhm.
money that they offer, and some of them are a little bit more stingy. So
Mhm.
I don't know. What advice do you have for anyone who's looking to go into locums or doesn't know kind of like how to get started?
Yeah, it's a great question. I mean, I like using TikTok and Instagram and social media to kind of see what's out there so I can get like a real life view of what the lifestyle is like. The Facebook pages, I got so much information off of those and also got great contacts for people that were in my specialty. Like you said, like neurology has a very specific um kind of paradigm of what the rates are and what companies pay better than others. Same with PM&R. So going on the Facebook pages and seeing who's asked questions that are specific to your specialty is critical, and connecting with those people that have already done it and have experience. That is where I think there's a lot of value. And I found that a ton of locum people want to help the next locum person who's trying to get into it. So there's a lot of information sharing there, and you really, I mean, even if it's your first assignment or you're a new grad or you've been doing it forever, you have to be really solid in your what rates you're going to take and knowing your worth, because agencies and sometimes facilities, if you're direct contracting as well, they'll try to steamroll you because they want, it's a business, they want to save money, and if they can shave off $100 an hour from your rate, they will. And I don't take it personally, that's just a business model, but I know what I'm worth, and I just don't accept rates that are low. And like you, sometimes it's so variable. Like why am I getting paid a ton in Montana, but in my home state of Kentucky it's way less? There's kind of no rhyme or reason. So yeah, you just have to be ready to negotiate and walk away from a deal that's doesn't suit you.
In terms of the online platform, how did that change your career or community?
What's interesting? I've met so many cool people since I started doing social media and the website. I mean, I had multi-specialty groups reach out to me that wanted to make me like their medical director and start some really cool endeavors. And, even just doing cool things like this, like your podcast and meeting you guys. And there's just so many people out there, entrepreneurs that are trying to push the field of medicine, and I love that. And just being in those creative spaces with like-minded people, that's where cool ideas come from, like whether they're creative or business or both. So that's been the fun part for me in connecting with other people in my specialty. I've been asked to do a lot of lectures for residents recently, which has been so fun because they're just like, their eyes are, bulging out of their heads when I'm telling them that you can travel and do PM&R, and they've never heard of it before. And they've got so many good questions, and they're young and they're adventurous and they want to try something new. A lot of those speaking engagements have been really fun for me. Um, And some opportunities have been paid, some have been for free, but there's also been a lot of cool opportunities from a business standpoint and, getting some side hustle income and things like that. So it's been a fun journey.
What do you feel like is next for you? Are you going to stay locums, you think, long term, or are you at some point going to go part time W-2, or where do you foresee your career trajectory?
I don't know. I keep thinking like, oh, I could take like, each job is sort of like a try before you buy. So I'm always at that when I'm at that assignment, I'm like, could I stay here full time? Could I, do well in this small town or big town or whatever? So I'm always thinking, what if I stayed here permanently? So I don't know, but I think to myself, do I want to lock into a 3-year commitment? Do I want to do a 5-year contract? And I'm always thinking, oh, I really love only working like 6 or 7 months out of the year. And then I take my next assignment. And then going to the same facilities is really nice because then you do kind of get a routine, you build relationships with those people. So I don't know, to answer your question, do I think I'll do locums forever? No, I don't think so, but I do have a PM&R colleague, Val Jones, who's a great physiatrist who's been doing it for 18 years. Um, so it's not the out of the realm of possibility, but I think I will eventually find my forever home. I feel like a rescue dog sometimes, like, will you adopt me? Should I stay here forever? But I always have my eyes peeled and I like to see what's out there on the market. So I don't know.
Where can our audience find you?
The easiest way to find me is on Instagram, truthfully. I am an elder millennial, but I'm doing my best out here. But it's the Locum Lady is my Instagram handle. My website is drjacobshealth.com, and that's where my blog is. I did make some real amateur YouTube videos at one point, which are pretty cringe, but you can find those there, and my digital download and course and things like that. But honestly, and I do some on TikTok as well, Instagram. If you slide into my DMs, usually I reply to people. I think that's how we met, right? Was on Instagram DMs.
Or there are more younger doctors I'm seeing on TikTok and Instagram talking about the locums life. And back to what you said, it's like once you have the taste of that flexibility, and also
Yeah.
the money is better, it's really hard to leave that to go back to like a W-2, like full time. This is what I'm doing 9 to 5 every single day. I have to ask for PTO. I have to do this. Like, it's just hard once you've gotten used to it.
It's a pay cut if you go locums to W-2 at that same job. So, I mean, like the place that I'm working at now has offered me a full-time position, and I'm like, it's a significant pay cut if I take it full time versus just continue to do locums. But do you guys find that there's a lot of opportunity in your specialties and your areas, or is it kind of hit or miss?
Just being in the tri-state area, there's so many hospitals here,
Yeah.
and we have such good public transport that I don't really have to leave the state, or even if I do, it's a train ride away and then you come back. So I'm finding decent amount of work for neurology. Like you said, when I do, there's a contract locally that I'm pretty regularly there, and they have offered me, like a full time or even a part time if I
Mhm.
really want to take it. And it is a pay cut, Jenny.
Yeah.
And there's no way to justify it. It's like, yeah, the
Yeah.
benefits, but like, are the benefits really worth like this much money? I
Right.
mean, who knows? Shala and I recorded something about 1099 versus W-2, where some people argue that you want the stability of a W-2 job, but I find 1099 work to be stable too if you diversify.
Yeah, I think that's smart, and having multiple streams of income or different jobs, like say one, they hire a permanent person, you've got backup jobs that you can go to, I think is super helpful. And that's to another point that you brought up when I talk to residents and give lectures. I'm like, it's just a fact you're going to get paid more as a locum. And they're kind of like, wow, they hadn't heard that before, or like they don't believe that it's true, which is again why I tell people my rates and things like that. But I left med school with a ton of student loans. Like I think 320,000 is what I left with. I got to pay those off, and I can't really wait like 10 years to figure out if, PSLF is going to work out or not. So that's another reason that I do it. And of course, the tax write offs as a 1099. are a huge component. Although I don't know about you guys, but I've had a really hard time finding a good tax accountant that knows different state tax laws. So that's been kind of a challenge for me personally.
These are all great points. I think probably some of the hesitations is maybe the benefits for some people, and they feel uncomfortable kind of signing a job without having the benefits or the 401k or the match. But as you said, I mean, if you account or factor in all of those, then the locums and also the tax write-off, most likely the locums is paying more, and with more flexibility, more autonomy, more time off, because you cannot find a job that will give you 6 months off, right? Or
For sure.
whatever that you ask for. It's just not, those permanent positions are not flexible like that. How do you handle your benefits?
Well, so I have a SEP 401k, so I pay into my own retirement. So I put as much as possible into those accounts when I'm doing 1099 work. Some of my locum jobs are W-2. There's pros and cons to that. It's easier for tax purposes. There's no benefits, of course, but they just pay as a W-2. But most of the jobs I do are 1099. Um, and then for a while, my spouse was covering my health insurance, but now I'm single, so I'm having to do my own health insurance. I usually tell people to go to healthcare.gov because you can see all the plans that are available to you in the US. Um, but that's obviously an added stress, is like figuring out healthcare and stuff. But yeah, I make up for some of those sort of creature comforts in doing W-2 by having extra income that I can use to go towards retirement and just paying things cash, basically.
And then the write-offs, as you mentioned, there's so many things that are tax deductible that if you have a good accountant, you can use to your advantage. Mine's okay. I think overall it's challenging to find a really good accountant who works with physicians who travel quite a bit.
Yeah, I think one year I worked in like 4 different states, and this poor tax accountant's head was ready to explode. And so I've gone through, I think, probably 3 at this point, and now I'm like, I guess I'm the tax accountant, but it's just not something that I ever wanted to do or be good at. So yeah, if you guys have any recommendations, I'm all ears.
Yeah, I like my tax accountant. So far, it's been good, but I also have not traveled to a lot of places. The mainly what I've done is tele coverage in the other
Yeah.
states. I started that this year, so basically for 2025. So we'll see, if he gets confused or not.
Are you guys an LLC or do you have S corps at this point?
I'm an S corp. In California, we physicians are not allowed to have LLC. It has to be corporations,
Oh,
basically, for healthcare services.
oh,
Yep.
interesting. I didn't know that.
In New York, you can do LLC. So I'm an LLC that identifies as an S corp, but I also do telemedicine in California. So that ends up being a little tricky. So I mean, it's
Yeah.
it's what it is, but I think everything funnels through S corp. So I
Mhm.
don't know. We'll see. So far so good with taxes, but that's
Mhm.
yeah, that's another layer of complexity that I think in general people might not want to navigate. I know physicians as a whole, we tend to be a conservative group. So,
Yeah.
you want to go to work, come home, and that's it. Whereas if you're a
Right.
1099 employee, now you're taking on a whole bunch of other responsibility that you may or may not want to do. So I think that's definitely something to
Right.
consider for folks looking at 1099 or locum tenens.
Yeah, and you do kind of have to have an interest or at least be open to the business side of medicine and the entrepreneurial side of medicine, because there are so many tax advantages. And you're right, it's not just like filing a W-2. You have to really educate yourself on a whole nother realm that we don't get training for in med school and residency and things like that. But it is fun to learn new things. But yeah, you kind of have to have that extra drive to figure those pieces out, which, some people want to do, some don't. I don't, but I'm still doing, at least from the tax standpoint. I feel like learning the business stuff and the entrepreneurial things has been amazing. Um, but yeah, running payroll and, figuring out all these different documents is less amazing.
For us, once we started this podcast, we've been meeting a lot of different people, entrepreneurs, people writing books, people doing, AI devices and things like that, and people who are doing locums, even APPs who have their own practices. So it's been really, really an eye-opening experience for us as well. We're learning a lot from people.
Yeah, absolutely. And I think that's just the coolest part. Every time I do a podcast, you learn experiences or like thought processes from other people that you can apply to your own business or situations.
We've talked to a couple of our friends who are APPs, PAs, and nurse practitioners. One of them is in aesthetics, just to kind of get like their point of view on the APP landscape. Do you work with APPs in your assignments? And
Yeah. Yeah, usually they're nurse practitioners. So at my current place, like I have an NP that does consults for me and then an NP that does internal medicine for me. So I'm not overseeing their license, which is nice, but anytime I am in a locum position where I'm overseeing someone's license, like that brings the rate up higher because then I have to, double check all their work and sign off on their notes and things like that. But I've had great experiences with the APPs that I've worked with. And it's interesting to see who's allowed to do what based on different states, because sometimes you can be fully autonomous. In like in the state of Maryland, you don't have to have a physician sign off on anything, whereas in Montana you have to have an overseeing, a supervising doctor. So yeah, that's an interesting take on how PAs and NPs work locum positions.
What are your thoughts about that?
You mean just in general working with APPs?
I mean, no, the part that in some states they are able to practice on their own, given half the time that they spend for school and training and all that, because we did record some episodes about that too, which we are thinking like, is our training too long, or college, medical school, residency, fellowship, or is theirs is too short?
Yeah, that's a great question. And I kind of have mixed thoughts on it. I know it's very controversial, and we talk about this a lot also in PM&R because even within PM&R, there's internal medicine doctors that now can get a little R certification, and then they can be qualified in the eyes of CMS, Medicare and Medicaid, to run a rehab unit instead of a fully trained 4-year residency PM&R doctor, which is just like mind blowing to me. I was like, so the 4 years that I spent learning this specialty, someone else can pick up after doing some online training as a doctor. It's like, okay, well, can I learn how to do cardiology as a doctor by doing some online training? No, I don't think so. Um, but there's some APPs that I would go to as my primary physician, and there's some, that I think are can do the job of a physician or better, and then there's some that I wouldn't trust with, my healthiest patient. So I think it's very subjective. It makes me a little nervous, states that allow full autonomy of APPs, because we just get so much more extensive training, and there's those nuanced things that can fall through the cracks, and that's when problems come up. But they're very helpful for me. Like, I would be spread so thin at the current job I'm at if I had to do all the internal medicine, all the consults at the main hospital. So they help me a lot, but I don't always feel like they can fully replace a doctor. But some are way more competent than others. I mean, same as physicians, there's good ones and bad ones out there.
there's definitely variability. I think what becomes a little concerning, and I don't think it's controversial to say that, is a lot of the new APP mills where people are just going directly through without any nursing background or bedside nursing experience. Where I think the APPs that I've worked with and the ones that Shala has probably also worked with that are great, and and the ones that you work with who are good have probably had some like extensive bedside training and some bedside
Mhm.
knowledge. Whereas I feel like now people are just going right through and taking care of patients, and that's I don't know. I never felt comfortable coming out of residency doing that, right? I mean, even though we were probably more qualified. So it's interesting that they tend to be so confident. But with that said, there are also APPs who know their limit. So it's just a matter of,
Yes.
I think, standardizing their education and probably some amount of their training as well before sending them off autonomously into the world.
Yeah. Yeah, I agree. I think our training is very long, but I think probably if anyone's training should be longer, perhaps theirs, or just tacking on, some extra clinical hours, especially for those that didn't do any before. Because yeah, you can tell pretty fast, who's had bedside time and who hasn't.
This was really nice. And I have to tell the audience that you and I went to medical school together in Virginia.
Yes.
Santoshi has been following you on TikTok. And when she asked you, and I saw you here, I was like, wow, that's a familiar face. We went to medical school together. So it was a nice surprise again.
Yeah, such a small world. And what does your husband do? Because he was in my class, but what did his specialty end up being?
He is in internal medicine at the VA.
Oh,
Yeah.
nice. Okay. Oh my gosh, what a
Yeah.
small world. Because you guys met at med school, right?
Right. Yeah. We met in med
Yeah.
school and now we're in Walnut Creek, California. So we both live in this area.
Well, so I was just telling my friend earlier, I'm actually thinking about doing a road trip down the West Coast after my next stint in Montana. So I've got friends in LA. So maybe on my way down, I'll stop by and we can meet up.
Definitely. Yeah, definitely. We would love to. And you should definitely do the West Coast trip. It's beautiful here.
Yeah, yeah. My background, I've already set myself up, so I'm manifesting it.
Right. I see it. Any final comments for the audience?
No, I don't think so. I think we've covered so much. My message would be to anyone that's thinking about doing locum tenens work, that's nervous, and there's so many questions and unknowns. It's just like med school and residency. You just jump in, rip the band-aid off, try it out. And if you hate it, you don't keep doing it. Or if it's an assignment that you don't like, you just don't have to necessarily go back. And people jump on and off the locums bandwagon all the time. So it's not forever. Just give it a try. You might really surprise yourself.
Thanks for tuning in to Be Empowered, the podcast. If you enjoyed this conversation, don't hesitate to subscribe, leave a review, and share with someone who needs to hear this. Stay strong, stay empowered, and we'll see you next time.